Good morning. I'm Muriel Bowser, Mayor of Washington, D.C. We are here in the Marion S. Berry Building in Washington, D.C. to provide an update on the district's response to COVID-19. Can you hear me? I could have a little bit more, I think. I'm joined today by at-large council member Christina Henderson from the Council of the District of Columbia, as well as the city administrator, Kevin Donahue, deputy director for health at DC Health, Patrick Ashley, and deputy mayor for planning and economic development, John Felchicchio. We made several announcements on Monday, and we are coming back to talk about more strategies to keep DC residents safe before the holidays and to stress the critical importance of getting vaccinated and boosted. So to kick things off, I'm going to ask DC Health and Patrick Ashley to go over a number of things that we talked about on Monday, as well as our increased focus on testing, masking, and getting vaccinated and boosted.
Thank you, Madam Mayor. Good morning. The CDC is currently reporting that 73% of all cases in the United States is the Omicron variant. And we know that it's a matter of time before we see the same thing here in DC. It has taken over the US as the most dominant strain. And compare that to about a month ago when we saw Delta was the most predominant strain in the United States. Locally, we still only have here in DC 25 confirmed cases of Omicron. We did get some reports overnight that we have at least 50 more cases that have recently been sequenced that we're working to confirm. But we know it's a matter of time before we see that here in the region. We also, looking at our case data, as we flip to the next slide, we've seen a tremendous jump in our case rate, which is indicative of both what we believe is the winter surge as well as Omicron here in the United States, in DC and the United States and around the world. So over the last several days, we have reported approximately about 1,200 cases each day. And if we compare our case rate to 30 days ago, we were at 13.7% daily case rate per 100,000, and we are now at 123.8, and that's 9 times higher than we were 30 days ago. We know that brings a lot of anxiety. There's a lot of COVID in the community, and it's understandable to be anxious. And we've seen that at our testing sites. I've heard that across the community. I've heard that even with my own friends. And we get it. We know that people are concerned about this. There is some good news to this, is that so far our hospitalization rates have stayed the same generally. We've also seen that deaths have not jumped up. We know that hospitalizations and deaths are lagging indicators, but the good news here is as we look at other parts of the world that have had this disease and experienced this surge of cases already, that their data shows the same thing, that we're not in for a tremendous surge of hospitalizations or death. And that's great news for the community as well as for our hospital capacity. We are in the community having a 5-day decrease in cases that are in the hospital. And so even though we're seeing those surges cases, we're confident that our hospital system and healthcare system has the ability to take care of anything that we see in the community. We've seen a tremendous demand on our testing resources in the community. We've seen over the last couple of days, we've seen 14,000 or more individual tests that are being done. We've seen that at our community sites. Again, those are about 50% of our volume in the community. And as we expected, even though we have tremendous amount of testing capacity in the community, we have seen the turnaround time on our tests jump up just slightly to 2.64 test turnaround time. And so that's to be expected as our national labs and our local laboratory resources are working around the clock to get these tests processed. And we talked about how we've made testing available in the community. Yesterday, we put out 17,000 Test Yourself kits into the community. And today at noon, we are starting the Test Yourself Express program, and happy to take some questions about that. As we flip forward, I just want to talk a little bit about the demographics that we're seeing of the positive cases. So what we're seeing in the community is that we are seeing almost double of the cases being of individuals that are 25 to 34-year-old. So those are individuals that we do think are the most active in the community, especially in social settings. And so it's really important as we talk about this spread that we talk about how we use those layered mitigation strategies to decrease the spread in the community. And really having people start to think about their social gatherings, whether that, we know that Christmas is coming up, we know that New Year's is coming up, but want people to consider, wearing masks, limiting their activities, the parties that they're going to in the community, so that we do prevent as much spread, and we prevent you as a resident of DC from getting COVID-19. The good news here is that we're not seeing as high of case rates in our older population. These individuals do present a higher risk of hospitalization, and so it's very important that we're especially mindful in watching the data about where we're seeing the case spread in those demographics. So the slide in front of you, we showed this slide on Monday, and I think this is a very powerful slide. And what this is showing is the individuals who are getting this in the community. We're seeing that while we are seeing breakthrough cases, we're seeing those individuals at a far less significant rate than we are seeing unvaccinated individuals getting COVID-19. What we see with the national data is unvaccinated people are 5 times more likely to get infected with COVID-19 than fully vaccinated people. Our local data shows that individuals are 7 times more likely to get COVID-19 if they're unvaccinated. And so we want to encourage everyone to get vaccinated, whether that's your first shot, your second shot, or your booster dose. What we also see is about hospitalization, and this is where we're most concerned, is with severe illness that leads to hospitalization or death. What we see is that individuals are 8 times more likely if they're unvaccinated to end up in the hospital. What's concerning, especially here in the DC, is that we see you are 15 times more likely to end up in the hospital if you are unvaccinated than if you're vaccinated. And so if that's not the story to take home to your friends and to you if you are unvaccinated, that's the reason we really want individuals to get vaccinated and get that started today.
And Patrick, just to confirm that the graphs represent the DC data.
Thank you, Madam Mayor.
Okay. In both cases.
So as we move on here, as we talk about the deaths, again, sort of the most significant, we do see that unvaccinated individuals are 14 times more likely to die of COVID-19 than fully vaccinated people. And so as the mayor pointed out, the graphs on the screen is that of DC data. So what we know from CDC data, again, just to sort of underscore this a little bit more, is that fully vaccinated people with boosters are 10 times less likely to get COVID-19 than those that are unvaccinated. And we know, and this is all about boosters, right? This is the importance of why we want individuals not just to stop at that second shot, but also to get fully vaccinated and their booster, because that provides more protection for them, especially as we see increased spread in the community. Fully vaccinated people with boosters are 2.5 times less likely to get infected with COVID-19 than fully vaccinated people without boosters, and 4 times less likely to die from COVID-19. And then finally, fully vaccinated people with boosters are 20 times less likely than unvaccinated people to die from COVID-19. And so we want individuals to not only get vaccinated, but we also want them to get boosted. So the data is clear here. Individuals that get boosted have the highest degree of protection from COVID-19. And so again, as we can't say this enough, it's not enough just to get your 2 shots. You've got to go out and get your booster. We also know that there's going to be a lot of COVID-19 in the community. We've seen that over the last couple of days. We've seen those case rates of 1,200 per day. So many of your friends and family, and perhaps you, may end up becoming infected with COVID-19, and that's why it's important to have that degree of protection, especially as we see it in the community spread. As we look at our vaccination rates around the community, we're very proud here in DC that our seniors answered the call and have a tremendous vaccine coverage. But we do have some concerns here, especially amongst our younger population that has not been fully vaccinated at this point in time. And as we talked about a few minutes ago, that's where we're seeing the case spread. And so we're calling on individuals that are younger to get fully vaccinated, to get that first shot, to get that second shot. But we also want individuals to get boosted. And as we look at the data of boosters, we have a tremendous amount of work to do here in DC to get people boosted. And we see that our seniors have again answered the call on the slide with the boosters. We've seen that the seniors have answered our call and gotten boosted, but we're not high enough, right? Because they represent the highest degree of risk to us. And so what we are going to do is allow seniors at all of our DC-based vaccination sites that are 65 and older to advance to the front of the line starting today so that they can get a booster as soon as possible. With that, I will turn it back over to the mayor for our action plan.
Thank you, Patrick. And we continue to emphasize the strategies before you, as we talked about in some detail on Monday. We have expanded, or we are expanding our testing capacity. I have directed the Department of Health on an emergency basis to order 5 million more rapid antigen tests, which will take us up to 6 million ordered. You will hear frequently from DC Health what we have on hand and how we are getting that out. There's 260,000 rapids on hand. We have committed a certain group of them to our post-winter break and high-risk setting strategy for schools, child care centers. After our announcement on Monday about schools, our child care centers also requested an allotment, which we are going to make available for post-winter break. And we are also reserving 50,000 of those tests for our high-risk congregate settings. Further, we are grateful to the DC residents who are vaccinated and boosted, who are volunteering to help us put together those test yourself kits, which we continue to emphasize as a great way to access testing. They are at over 30 of our libraries. We ask people to take what they need because our volunteers are helping us put them together as fast as possible. The kits that contain the swab and all the testing materials. You do it yourself. You drop it off at your neighborhood library, and our labs will turn them around as soon as possible. Patrick just reported that we're at about 2.5 day turnaround. I've asked the National Guard this morning to assist us at our warehouse with any logistical support right now. That's for test yourself kits, and they have been helpful to us throughout the pandemic with logistical support. So we're going to ask them to do that again. We've also begun to modify some of our operations at senior sites, with many of those sites going to virtual events. Seniors are advised to call or check ahead online before attending a program or event to find out if it is now virtual. You can call 724-5626 to learn about senior programming and grab and go meal options. We are adding an additional strategy to what was a 6-point plan for the winter to a 7-point plan. And so we are, there's been frequent comparison between the situation now and in 2020. But we know very well that it's not 2020 because of the vaccine. We have a safe and effective vaccine that is available for people 5 years old and older. In 2020, we had to shut down because we didn't know a lot about the virus, and we knew it was very dangerous, and we didn't have effective pharmaceutical interventions. But now we do. Patrick showed us the data. The vaccines are working, and they're working well to keep people out of the hospital and to keep people from dying from COVID-19. So we don't need those type of shutdowns, but we do need more people to get vaccinated and boosted. I talked to you already about how we were turning up the DC government mandate for our employees, and that will now include a mandatory vaccine, 3 shots, a 3-shot requirement, without the option of testing out. We're also very focused on gathering places in our community. So beginning on January 15, 2022, certain establishments will be required to verify that their patrons 12 years old and older have received at least one dose of the COVID-19 vaccine. And so here is the timeline for how we will roll that out. First dose for patrons 12 and older beginning January 15th. Second dose by February 15th. Enforcement of the vaccine requirements, therefore, would begin by January 15th. The places that will require a vaccine are restaurants, bars, and nightclubs, indoor cultural and entertainment facilities, indoor exercise and recreational establishments, and indoor event and meeting establishments. People will be able to demonstrate their vaccination status using a CDC-issued vaccination card, an original paper version or digital version, an immunization record printout from their healthcare provider, or a COVID-19 verification app such as VaxYes or Clear. In the coming days, we will be releasing more guidance around these requirements, but we wanted to announce it today so businesses have as much time as possible to prepare. If you are a resident who is not yet vaccinated and you want to continue enjoying these activities, now's the time to get vaccinated. And as we have done in other cases, the Department of Health, or I think this is coming out of DC Health on our coronavirus.dc.gov, where we have provided quite a lot of signage so businesses don't have to recreate it. You can go to vaccdc.dc.gov to download a sample of the signage requiring vaccination to enter. I also wanted to highlight, and I'll turn to Councilmember Henderson to talk a little bit more. But this month, actually yesterday, the council passed legislation that will require all students who are eligible for a COVID-19 vaccine that has been fully approved by the FDA to get their immunization. So let me turn this over to Councilmember Henderson.
Thank you, Madam Mayor. So yesterday the council took yesterday the council took a second vote on the coronavirus immunization of school students and early childhood workers legislation. So as the mayor said, this requires that beginning March 1st of 2022, all students, this is public school, public charter school, private and parochial schools as well, will need to be vaccinated against COVID-19 by a date certain. We will begin, this is essentially adding the COVID-19 vaccine to the list of vaccinations that are already required for students in daycare centers and childcare centers. We also added to this legislation language that essentially puts into law a mayor's order with regard to vaccination requirement for early childhood workers as well.
Thank you, Councilmember. And so this adds to the safety of our schools. You will remember that all school personnel have been for a couple of months now required to get vaccinated without a test out option. And we began to mandate for students, I believe at the same time, student athletes who were participating in high-risk activity to be vaccinated as well. So this is another part of our strategies to keep our schools and child care facilities open and safe. And so we urge parents right now to make a plan to have their children vaccinated, even before the deadline. Because the benefit is you get the extra months and weeks of protection. So there's really no need to wait for the deadline. So with that, we want to, of course, celebrate the season, but we also want to remind residents to choose safer activities as you celebrate. Outdoor activities are safer than indoor activities. So think about how you can enjoy your family and friends in an outdoor setting. We recommend avoiding crowded indoor or outdoor settings. We recommend that you wear a mask even in private settings where you're not sure of the vaccination status of your friends. And actually, we suggest that you do know their vaccination status and think about only attending events where people are vaccinated. Avoid events held in poorly ventilated indoor spaces. Choose less busy times to attend holiday activities. Choose to attend or host small gatherings instead of large gatherings. Use testing to know your status and the status of people around you, and report your status if you're using one of our at-home tests to coronavirus.dc.gov /over-the-counter. So with that, we're happy to answer your questions. Yes.
Thank you. Mayor Bowser, I wanted to ask about different venues that might be covered by this new requirement you're asking, like grocery stores. Are there other, I know they're not listed here, but are there specific exemptions or businesses that would be exempt from this?
Yes, there are. Who was it? John or Kevin, you want to talk about the businesses that are covered and the notables that are not?
Right. So all this will be updated onto the vax.dc.gov website. But what we want to do, and what we're, if you look at this slide, what we're actually aiming this at is where people congregate or where people gather. And so something like a grocery store is not someplace where people gather. And so based on what the health experts have told us, we're really looking to start this program aimed at those places where people gather or congregate.
So grocery stores wouldn't be covered, just to be clear?
Correct.
Okay. And then what about staff? Is it patrons and staff at these venues?
So this is directed at patrons, customers, visitors at these venues. This is not an employer mandate. This is a vaccine requirement for those visiting these establishments.
Okay. And then is there any consideration into perhaps having patrons or people visiting these businesses show a negative test in lieu of a vaccination?
So that's not something that's being contemplated at this time. But again, the mayor has always reserved the right throughout the pandemic to dial up or dial back interventions. What we're also going to do over the course of the next few days, especially after the holiday, or in between the holidays, I should say, is engage with some of the stakeholders, some of the businesses, to see how they would implement this and to get their feedback. And then we have some more guidance that we'll put up on the website by the end of next week.
Okay, thanks. And I know more is to come, and not to get too granular, but I think if someone has, for example, a religious exemption or other reason why they can't be vaccinated, are there concerns about how this would affect them?
And that's what we'll have further guidance on by the end of next week.
Okay, thanks.
Mark?
So if we could just drill down a little bit more for a couple more specific places. Churches, will they be exempt?
They are not covered, correct.
Places of worship are not covered. How about museums?
They're not covered.
How about the office space?
So it depends, and this is where we kind of get into a level of detail that I'd rather us focus on. Kind of these are the major places where we'll have them in place, and then over the course of next week we'll put out guidance because there are office spaces that there are meeting spaces that are conference spaces, so it'll depend on what the purpose of it. If it's gathering people who are patrons, visitors, and not just the people who work in the space, it may be covered. But we'll get that level of granularity in the guidance that comes out by the end of next week.
And then retail, just in general retail, is that the same as groceries?
So similar to grocery stores and retail, it wouldn't be, because again, it's not a place where people go to gather and congregate. The places that we have listed here on this slide are the places that we, or the categories where we'd say that happens.
Okay, and then just my last one on this granular. This is for indoor venues, so I'm thinking specifically a place like Nats Park. Would an outdoor entertainment venue be exempt from this?
So right now we're specifically talking about indoor venues where people gather and congregate. The place that you mentioned, I don't think that would be considered. Again, we'll see as we get through this how we dial it up or dial it back based on what the public health experts tell us.
Okay, and then because Mayor, there's going to be pushback, obviously, as there has been for 20 months for everything. But, what do you say to people who might say, what's the difference between people congregating, by definition, in a church being exempt, and people congregating in a bar having to have this requirement? And then what also do you say about just putting this responsibility, this burden? It obviously will be a cost to businesses to implement this.
Well, Mark, as I told you on Monday, and I'll tell you again, we all have a responsibility to keep our community safe, and we all have to respond to this virus as it presents. It is true that we're asking our businesses to do more, but we also think that this is a benefit to their business.
And then can you just speak to the, why would a church be exempt and a bar not?
We have looked at the highest risk activities where we know that there is a lot of spread. We are frequently concerned about churches, and we have dealt with them throughout the pandemic, and this is where we stand with the vaccine requirement. Yep.
Hi. So I'm wondering, we just met on Monday, and you reviewed all the action plans, and so I'm wondering, was there anything that swayed you to do this vaccine requirement for select businesses now? I'm just curious about the timing.
Oh, we were considering, as I think one of your colleagues asked me, was I considering it? And we were considering it on Monday. It needed a little bit more work before we could announce it.
Understood. And I understand John said this is not an employer mandate, so I'm wondering, I could just foresee a customer going in, well, it's not a requirement for you, but it's a requirement for me as a customer. And so I'm wondering why not?
Well, we're focused on patrons and the higher risk activity that happens in our city, where we know there are big and small gatherings. And we are also focused on employees and employees, but it's just in a different lane. So we have been very supportive of the administration's focus on employers of a certain size. We will continue to be supportive of that. We will also continue to recommend to businesses to make decisions about vaccination requirements for their workers.
And have you spoken to, I'm wondering now, about like the Smithsonian's, the museums where people gather? Do we have any insight as to whether or not they'll follow suit?
Yeah, so we've been engaging with stakeholders. What we'll do next week, too, before we put out the final guidance, is actually do a little bit more of that more formally now that this has been announced.
Understood.
Right, and keep in mind, and I'm going from memory now, but someone may remember specifically, when we looked at the level of risk and activities, we always grouped the museums and the like. They were more akin to shopping malls than they were to restaurant, bars, and nightclubs in terms of the risk category.
And then just a question on Omicron. I'm wondering, you said you confirmed so far 25 cases. I'm surprised by that number. I'm wondering, are we doing enough sequencing? Could you just clarify why that number might be so low, and what the CDC reporting is, 73% of new infections?
Yeah, it's a great question. So what we've seen here in DC specifically is that we've lagged behind in Omicron as compared to some of the states in the Northeast, and they tend to be a few weeks ahead of us. So it's likely that we have not quite seen as much Omicron here in DC. That's not to say it's not here. And we also, as we talked about on Monday, sequencing takes 5 to 10 days. And we also see that while the laboratories have a tremendous amount of sequencing capacity, they also are seeing a tremendous amount of samples right now coming from all around. So we know that the sequencing is catching up. And like I mentioned, we have about 50 preliminary results that we're working on today of additional cases. And so we expect that number to continue to grow. We do that data analysis once a week when we get the results from the lab.
Thank you.
Yes.
I wanted to ask about concerns potentially around equity for businesses, particularly in areas of the city where there may be high rates of hesitancy or low rates of vaccination for businesses there. Have you given thought to equity concerns about patronizing?
I'm not quite sure what you mean.
So for example, in a neighborhood with low rates of vaccination, businesses there, if they must require a mandate for people to, or excuse me, must require vaccination for people to enter, that could present some challenges in areas where there are low rates of vaccination.
I do think that you're right to point out that we have a disparate experience with vaccination in our city, that we all have to lean into getting more people vaccinated and boosted. But that same disparity presents with hospitalizations and deaths. So we feel pretty right in making sure that opportunities for people to gather are as best protected as they can be.
Is there any consideration at this point to expanding DC's education around vaccines in these neighborhoods, or is there going to be an additional push now with this?
There will be an additional push. We're going to use every means and medium at our disposal to talk to people more about vaccination and getting boosted, especially getting boosted right now for the people who have been vaccinated who are vulnerable, and for people who don't have any protection. I mean, not even the first dose.
And maybe for you or John, but could you talk at all about what enforcement might look like around this?
So we've always led with education, compliance, and then enforcement. So what we'll do over the course of the next week is kind of go over how we'll roll that out. And that's something that we're going to engage the stakeholders on. One of the things that, is the simple thing. I know Mark was talking about like the interactions that people have, but to make it more clear for visitors, patrons, and guests to know which establishments they'll have to be vaccinated for. Simple things like signage have helped. Things like this have helped when we've tried to have people wear masks and such. So this work will all begin in terms of getting this out to businesses, which we want them to partner with us on this in order to make sure that this vaccine requirement does work.
And we've seen these mandates pop up now in a number of major cities. Is there one that might be a good parallel for people to think about what DC's doing? Or that you all used as a guide in particular?
Yeah, so we actually did look at several cities just to see how they did it. We've started to talk to some of those counterparts as well, just to understand what they did. We are sort of at the leading edge of the pack of cities that are implementing this, so we can learn from those who have gone before us. But I think we'll also learn from that engagement that we do next week in order to really understand how we'll implement this with our business community to make sure that it's viable and can be met by January 15th.
Okay, thanks.
Yes.
I'm wondering if it was an easy decision or a difficult decision for you to support the student vaccination, and also will parents and students have an option to do online schooling if parents are adamant not to have the vaccination?
We are adamant that we're going to do everything in our power to keep schools open. And I firmly believe that when we look back at our experience with COVID, we will have a lot of regret about keeping schools closed for the length of time that we kept schools closed. Our position, when I say our, I mean the country. I think that we did everything we could to get our kids back, and we're the first in the region to have in-person learning in DC, so we're proud of that, and we're going to do everything to maintain it. As Chancellor Farabee and Michelle Walker-Davies, who was with us on Monday, we are approaching our school year with, as long as we can operate our buildings, we're going to open them. And if we have to transition to virtual learning for our school, we're going to do that. And it's on a situational basis, school by school, as the health situation at that building and among the staff require. And so that is how we're going to proceed. The first part of your question, was it difficult for me? No, to support the legislation. I think the council has modified this legislation, I believe, in its final form to be in a state that I can support and gladly support. We have now a number of months experience with 5 to 11-year-olds, which this legislation covers. and it also allows for the final approval of the vaccination. And here's why I think it's important to talk about now, even though the deadlines don't kick in until March and the enforcement doesn't kick in until the next school year. Why wait? You're going to have to do it. You're going to have to do it if you want to go to public schools. Most of the private schools already require it. Why wait? Do it now. And then not only are you going to be ready for school in March and fully ready for school in the fall, but you're going to have 6 months of the benefit of being protected from this virus and having your whole family being more able to participate fully in the city and in the nation. So why wait? Now's the time.
Thank you.
Yes.
Mayor Bowser, I have 3 quick questions. Number one, this is more on a simple level. So when I go to my McDonald's on Minnesota Avenue to get my weekly Big Mac, I'm going to have to pull out my vaccination card to get in to purchase my Big Mac?
I don't know. We will have some exceptions for, I don't know the phraseology we're using, but quick trips. And the fast food establishments may fall into that category.
Aren't you concerned that by having to go into with your vaccination card, that this is sort of a reach of Big Brother intruding on your life?
You should know me well enough by now that I don't make any of these types of decisions lightly, because I don't want Big Brother intruding on my life. I like to make my own decisions. But I also recognize when you're responding to a global pandemic, that is the exact time when the government needs to make some decisions for the whole society. And we have entered into those decisions following the science, dialing up and dialing back as appropriate. And this is an appropriate action.
What do you say to people who are saying, not just you, but maybe across the country, that this is an overreaction to Omicron? Because so far, Omicron has not been proven to be as lethal as the Delta variant. So why go to this extent for a variant that is not as lethal?
Well, that is a good point. I'm glad you put it that way, because it is not as lethal. And we do have vaccine available that are safe and effective. That doesn't mean it's not disruptive. And that doesn't mean that we don't have a responsibility to contain it where we can, but also make sure that our public health system, which is what we're doing, is amply resourced and able to respond in the worst case scenario. We've talked today about amping up our testing capacity, which we are doing. We are in active discussions with our hospital providers to make sure that they have what they need in terms of surge capacity, and we will be making sure that that happens as well. But we continue to emphasize, as your question would suggest, that individuals have to make good individual decisions too. Yes.
Mayor Bowser, a couple of questions. First off, with regard to this vaccine mandate on businesses, New York City had that in place and still saw surges. We're 20 months in, and we see so far the people who don't want to get the vaccine are not going to do it. Why do you think this is going to work?
I think it will help more people get vaccinated. That has been our own experience with mandates. When we announced mandates for healthcare workers, for school personnel, we saw more people get vaccinated and demonstrate that they have been vaccinated. We believe that's going to be the same case for our own government employees who are currently using the test out option. We've seen that in the federal government. So we do know that mandates have the ability to move people who are not vaccinated to become vaccinated. And we also know that that is a huge public health benefit. You saw the graphs at the beginning, that the incidence of COVID among the unvaccinated with this new variant are substantially higher with people who have not been vaccinated.
And then, following up
But
to that.
that's not to say, and I'm glad you put your question that way, that even with all of the interventions that we have, and you can see it in New York City, you can see it in the places. Even with all these interventions, we can still see elevated cases. It's the winter, it's more gathering. We're more open across the country than we have been since the onset of this virus, this pandemic. And so even with everything that we do, we can see more cases. But the fact that we can report the level of case rise that we've experienced and have fewer people in the hospital than we had last month is remarkable. It's a testament to how effective the vaccine is, and maybe how this variant has evolved to be, less virulent. Yes.
New requirement. You didn't mention, I don't believe you mentioned the My IR passport, our healthcare.
I think I just called it something different.
Oh,
Yeah.
well, I mean, I'm just kind of curious about that, so it sounds like it will be accepted. And
Yes.
I believe, that company is looking to make it an app, and so I wonder if there's going to be any kind of support that you're thinking of in terms of helping these businesses because of these fraudulent, or sometimes they're fraudulent, like vaccine cards that are happening.
Well, we're not asking our businesses to be sleuths or detectives. We are asking them to use their best efforts to make sure their patrons are complying.
Okay, and then a second question on it is, some cities are requiring staff who weren't vaxxed to do, who aren't vaxxed to do weekly testing, and so I'm wondering if that's something that is on the table in terms of the employees of these businesses.
We haven't discussed that, but I will say that we want people to use our testing resources and use them wisely and get tested when they need a test, and get vaccinated because it's the most effective of the mitigation strategies.
And a last question on testing. Some people are contributing this, this vertical line to just increase testing, and I wonder if you can comment on that. Like, are we seeing? I think the Post reported that we had the highest daily case rate in the country, according to its own tracker yesterday. And so I'm wondering how much of that is testing. You're saying that it doesn't seem like right now Omicron is, we're not being hit as hard as like our Northeast states. And so I'm wondering, can you help explain the steep?
Oh, we're being hit hard.
Yeah, but
Okay,
Omicron,
there's a lot of COVID in the community.
Sure.
We have had a lot of testing, but we also have a lot of transmission.
Okay, thank you.
Yep.
Mayor Bowser, this is the nation's capital, which welcomes not only people from the region, but people all across the country in places that don't necessarily have the same vaccination rates. What is your message to those communities? Are they not welcomed here if they're not vaccinated?
I think people have to make decisions about travel based on, their own circumstances, and whomever they're visiting here should certainly want to know what their vaccination status is. If they have been tested and can present a negative test upon arrival, to isolate perhaps when they get here. But I think consider the circumstances of the people that they are visiting. All of those things are key in making decisions to travel.
So are you telling people if they're not vaccinated, they shouldn't come to D.C.?
I'm advising D.C. residents on how to keep themselves safe, and I've gone through that.
Another question. We asked you at the last press conference about fire department members and more numbers testing positive for COVID. Can you talk about the law enforcement side? Is there a threshold if so many officers are, out because of COVID? What's going to happen? Who's going to fill in? What's the contingency plan there?
We have plans, and I'll ask Kevin to talk about both of the public safety agencies that you mentioned.
For the police department, back in March of 2020, we asked police and every other public safety agency to make plans on the assumption that they would be out by different levels of staffing, so 10% of staff out, 20%, 30%, 40%, to the point where it could get, we didn't know where we were going, but to the point where it could get dire. And what we found for police, because of their ability to be able to utilize overtime, which is draining on staff who work very hard, they're able to maintain their service levels really all the way up through 20% of their staff being out. So they have the ability to absorb fairly well, and of course that is all based on the hardworking men and women of MPD pulling long hours. But that's how they would get through what they're experiencing now, and if it got much worse than what they're experiencing now. And they're not experiencing at this point anything close to those thresholds that I mentioned.
Yes.
Yeah, I have two quick questions. The first one is, have you guys had any discussion or thought about potentially opening more vaccination sites or extending hours if there is a surge of people, seeing this and saying, all right, I'm going to do it?
Yes, we don't have anything new to announce at this point. I spoke to you on Monday about a plan to open some retail sites throughout the city that will be operated by DC Health. That will be, I hesitate to say permanent, but permanent sites for us, for DC Health to offer a variety of services, including vaccination.
Right, and then my second question is, some of these people who have been holding off, not wanting to get vaccinated yet, might have been thinking in their mind, okay, if I get vaccinated, I'm going to want this specific manufacturer's dose. Have you guys had any thought or talks about that?
I think we've had at all of our clinics both Pfizer and Moderna.
Johnson & Johnson.
And Johnson & Johnson.
So you're not expecting that there's so much of a surge that you run out of the one that everybody wants?
Well, we're going to, Patrick, can you talk, or Kevin, about supply for vaccination?
Thank you, Mayor. So we've never had any concerns about the supply. The nation's supply of vaccine looks good when we talk to our federal counterparts. We see occasional disruptions for a day if we see a run on one product, but we're very quick to get that product back in. Supply has not been an issue since the summer, and so there's no excuse not to get vaccinated. We've had all three types.
Yes.
A couple quick questions on this, and then one off topic, if I could. One, is there any consideration being given to distributing masks, particularly quality KN95 masks, making those more available to people, residents?
Yes, we'll be looking into that for district-supported activities.
So at events, you would have them, is that what you're saying?
No, what I'm
Rather
saying
than making
is-
them available for pickup like you are the test kits and stuff like that?
I am saying that we'll look for them for our settings, for government settings like schools and our congregate sites.
And if I could circle back to the FEMS MPD, you gave the 20% threshold that could be absorbed by MPD. What's that number for FEMS? Is that also 20%?
It actually was remarkably similar.
Okay.
And now the way they would adjust service is obviously different for FEMS and MPD, but they were able to go up to the 20% threshold using overtime. Now, what we're having those agencies do, given Omicron and the 20 months of a lot of work on the part of those members of both agencies, is to update those plans. But what they have been doing to date, what they'll still do is be able to essentially ask their members to be able to work extra shifts and long hours.
And then we've been getting anecdotal reports on daily case rates for MPD and FEMS. We heard, and can you confirm, we heard more than 30 MPD officers just the other day tested positive. I think about 18 FEMS yesterday. Can you confirm those numbers?
I'll confirm them after that. Those sound about right, but I would want to confirm the exact numbers.
Okay, and then can you just talk about overall city services? Obviously, a lot of people are concerned about DC and fire, but there are other essential agencies. What is their ability, DPW trash collection, traffic control officers, to be able to absorb staffing pressures in those agencies?
We look at staff that are out, both for COVID and non-COVID reasons, 3 times a week. And very often those other agencies may not have the kind of staffing factor that fire and police do. So we're very mindful of any adjustments we have to make to service. So 3 times a week there's a team that's part of the EOC that looks at staffing levels, engages with those agencies, and sees if there's any adjustment to service that have to happen. So that's a process we have in place, and I don't doubt, like we've seen with schools over the course of this wave, there'll be adjustments that we'll be making in different agencies based on a case-by-case basis.
And then my one off-topic question, January 6th is going to be upon us soon, and I don't want to read anything into requesting National Guard for the test kits, but I'm just wondering, are you making preparations? Do you have concerns about possible protest gatherings, anything that could happen on the anniversary of January 6th?
Yes, we have a kind of internal checklists that we review anytime we think that there is a high-profile anniversary or national occurrence, and that is certainly in the list. MPD has been thinking about it for a little while.
And so if I'm just wondering if you have the National Guard activated to take care of the test kits, would that also encompass if you needed to move them to the Capitol or anywhere else in the city?
No, that would be an additional request.
Thank you.
Okay, I'll take a few more questions. I'll start with Michael and go across. Yes.
Thanks. A few probably for Patrick. I know some people right now who are at the Shaw Library trying to take advantage of the new antigen test program, and there's a line that's apparently wrapped around the library 3 or 4 times. What would you say to people who are maybe standing in line and pondering their options as we get closer to the holidays?
Yeah, thank you for the question. And we know people have been taking advantage of testing. We've seen record number of individuals excited to take advantage of the district's robust testing. We have some of the most accessible testing in the country. And we announced the Test Yourself Express program that started today. And so we know many individuals came to the libraries to get those tests. There's plenty of supply. We talked about that on Monday. We talked about the numbers that we have. And so individuals will get tested if they want to get tested. I do want to emphasize, we don't talk about this enough, is that testing is not a free pass to do what you want. We want people to still take those precautions. And so a lot of people are really interested right now in getting a test result before they go somewhere for Christmas. So we want them to know their status, but we still want them to take precautions as they get those tests.
Thank you. And then is DC tracking boosted versus unboosted breakthrough cases? And can you say anything at this point about what you're learning from that?
We are tracking that data. I don't have anything to share specifically about that.
Okay, I'll follow up. And then I also wanted to ask about the DC Can contact tracing app. I guess it's not an app or technology via phone. Is that working properly for residents right now?
Sure, it is working properly, and I think probably the genesis of your question was a report that somebody said they couldn't access that. Yeah. We did have a issue that lasted just a few days where we had a high volume of text messages that were going out that tripped automated spam trigger with our vendor. We've resolved that, and individuals can access that system. It didn't impact any of the system functionality. It just meant that a certain amount of individuals couldn't get their codes each day.
Could you say how many people might have been affected?
It was not a significant number.
Okay, thanks. And then one last one from me. I wanted to ask about schools and if there's any concern about if schools are reporting their COVID case counts to DC's satisfaction. At Wilson High, student journalists there counted more than double the number of infections the school has disclosed. Parents there and at other schools are also telling us that they believe their schools might be underreporting case numbers. So I wanted to just ask if there's any concern there.
I don't think so, but there could be some lag in terms of the anecdotal experience that people have and what gets actually reported and the time at which it gets reported centrally. That would be my guess if there's any discrepancy.
Okay, is that something you might look into?
We're looking into schools every minute of every day.
Thanks, Mayor.
You bet.
Just 2 quick questions on the rapid testing. Are you going to, I was just at the one in Mount Pleasant, and it was just one librarian who was kind of helping out a crowd, and so I wonder, is your team going to offer any maybe more support for librarian staff there as they're handling crowds of people?
Yes, we are. We're looking at some crowd control support for the lines and, if needed, for the distribution.
And a second question on that. Right now, we're at 8 sites that are offering these, 8 libraries that are offering this. I wonder if there's any interest to expand before New Year's Eve.
It'll be based on the supply of the test, and as we get them,
Gotcha.
we will make them. We would, of course, want to spread out. Where I've also asked the team to think about some other delivery methods for our senior residents.
Thank you.
Yes.
I want to ask you a question about what happened at Watkins Elementary in the Holocaust reenactment last week. Why should parents of students at DCPS be confident that complete background checks are being done on potential employees when we did a simple Google search and found potential hiring issues with the teacher who reenacted the Holocaust at Watkins, a criminal record, and a loss of a teacher's license in New Jersey?
The chancellor addressed that on Monday, and I know that he's digging in to the hiring process and those decisions, and he'll report that. We're all pretty stunned by what happened. We only want personnel who will make good decisions, and the management of the school, we think, reacted appropriately. Yes, and last question. Yes.
Going back to the rapid tests that are now available at the libraries, is there any concern that people might try to take advantage of that? Because I can tell you anecdotally in the region, parts of Virginia and Maryland, rapid tests are off the shelves in supermarket or pharmacies. And so, is there any concern that people might start just grabbing them to sell on their own or do anything like that?
They would get in a lot of trouble if we found that, and we will. We usually have those consumer protections that associate with any state of emergency that I'll declare, and I'll make sure that that's in place as well. But let's face it, I think the vast majority of people are doing the right things and want to access it. And there can always be a few bad apples, as you have pointed out. One librarian that made a bad decision in our schools, but I think the vast majority of people who are waiting are doing the right thing. We've also limited the number that people can get, so you can get 2 of these, and these contain 2 tests. So 2 of these equals 4 tests that you can take, and you have to provide DC ID.
We mentioned some anniversaries earlier. Today makes a year since you named Chief Conti as the Chief of Police. Do you have, anything you want to say looking back on the year and just, the job that he's done so far?
Well, happy anniversary to Chief Conti, and thank you for noticing that. And we have just spent a year very focused on public safety. I think he's the person to have that laser focus on DC. He knows our communities. He's had a lot of different jobs at MPD, including being a district commander, responsible for deploying our MPD resources in the most effective ways possible. I think most importantly, he has the trust and confidence of DC residents. And he's been out all around the city talking about his plans. I will say, too, that the innovation that he's showing in policing is going to be what helps us bend the curve, making sure that we're partnering with our federal partners, that we're using intelligence-based policing to deploy in a targeted way. And being a leader of our force is very important. So congratulations to Chief Conti, and I know he won't be satisfied, like we won't be satisfied until our people in our city feel safe. Thank you, everybody.